Try always to have a means for doing call test in your clinical practice because it's a more simple, cost-effective pulp sensibility test with comparatively high accuracy rate. You can either use a green endo ice from Coltene or Endofrost from Coltene, which is most commonly being used in clinical practice. Spray it on a number 2 size cotton pellet with almost 5 mm size till it gets saturated completely, and then apply it on the middle third of the facial or the buccal surface of the tooth for 5 seconds or until the patient feels a pain. And there is a sequence for testing. First you test a disease-free contralateral tooth, then an opposing tooth, and then a healthy tooth within the same quadrant, and then finally the suspected tooth, so that it minimizes the chance of errors. How can you assess the response? If the patient perceives a sharp localized sensation of mild to moderate intensity that doesn't cause much patient distress and the pain subsides once you remove the stimulus, it's a normal response. And if there is a sharp pain that subsides when you remove the stimulus or within seconds, it's indicative of reversible pulpitis. If there is a sharp pain and once you remove the stimulus there is a prolonged dull aching pain that lasts for a long time, it is indicative of irreversible pulpitis. And if there is no response, it is indicative of a necrotic tooth. And call test can be used in patients with porcelain jacket crowns or PFM crowns, and it's more reliable in young patients with less developed root apices. But there can be false responses in cases of calcified pulp chamber, extensive restorations, and patients on pre-medication. So always correlate your findings with clinical history, clinical findings, and radiographic features.